Assalamu alaikum warahmatullah. This is Abid and I'm a specialist in sports. Today I'll be discussing with my friends about the return to sports in the cases of ACL reconstruction surgeries. See, we get a lot of cases in our clinic about the ACL reconstruction surgeries and all. And they always ask the common question. It's like, when they will go back to the sports. And it's very difficult for us to answer them. Because for going back to sports, each individual have a different capacities. They should have a good strength, they should have a good flexibility in the joint, they should be having the full range of motion, and they should have a good balance, proper reception, and all functional assessment should be normal. So normally there are like some people, like 60-70% of people, they go back to the pre-injury level, they can play up to the pre-injury level. There are some people, 20-25, they just come down, they don't do much, and there are some percentage of people, they re-injure it. There's recurrent injury and all. But before going back to the sports, there's a lot of decisions to be taken and all. It should be in consideration with the IKDS, International Knee Documentation. So there are some special tests which we do so as to decide that this guy can go back to sports or still he needs some workout to be done. But it's not everything. They're like, you have to collaborate with the orthopedic surgeons and all, and they should also give you okay before you go back to the sports. But normally we do some tests, and these tests are like Hope test, it's a Y test, and it's a T test. There are T agility tests and Y agility tests and Hope test. Right now I'll be just discussing about the Hope test and all. But in the next video, I'll be showing you how we do the Hope testing and all. Okay. Normally, we do Hope test should be done after 6 months, and 9 months, and 12 months. And they play football like after 9 months and all. But let's say like an elite athlete and all, they play at 9 months. Normal athlete and they play after 1 year and all. So what's Hope test and how we do it? This is just brief idea I'll be giving, but next video I'll show you how we do it. Okay, this test is of different types. There's a single leg Hope test, there's a triple leg Hope test, there's a crossover Hope test, and there's a 6-meter time test, time up test for the Hope. There are different tests also, quads and gluteus ratio and all, flexibility in this and strength and this thing. That's where that we will not discuss. Just to make, when you say like when you go back to the sports and all. So how we do a single leg Hope test, before you going back to these tests, we should have a program for RTS. There's like a program, exercise protocol for return to sports. That means they should be trained for these hoping and all. So that's after that you will start doing these tests and all. The 3 trials are given, and out of 3 trials, 1 trial is taken. The athlete is asked to jump from a starting line, and he will land up, and this both the lines are marked and the leg measurements taken, both the surgical leg and the non-surgical leg, and then the length is measured and it's divided, the injured leg divided by the non-injured leg, and get the percentage of this. And this leg should be 90% similar to the non-injured leg. Okay. Next we will be doing with, okay. So in the triple Hope test, the athlete will jump 3 times in the same leg, 1, 2, and 3, and he has to maintain this last jump for 2 seconds, and we'll measure from the starting end to the end, and the involved and the non-involved divide and get this one. And the crossword, same thing, will cross from one to the other Hope to the other side of a line, and then cross to the same side of the line. Then again we measure the length and involved and non-involved, and we take the percentage of this thing. Other test is like 6 meter. We'll have a 6-meter line, and he will be hoping, and we'll just see how much time it will take him to hope for the 6 meters. How much time? Okay, so it will be the time of the involved and non-involved leg. We divide it, and we'll get the percentage of this thing. That's called LSI, limb symmetric index. Sorry, it's a limb symmetry index. Limb symmetry index, sorry, again. So after this, we can just refer them back to the orthopedic, that they are okay from us, and they are ready for the sports, and they will just assess with their own way, and they will just send them back to the sports and all. This is how it's done, and this is how we do, and hope this video you like. Thanks for watching. Thank you very much.